Hi, this is Dr. Shankar Adisimilli. Hello to all of you. Just want to introduce you to my practice. I've been serving thousands of patients for the last 20 years in surgical practice in New York and then Chicago, and then moved to North Carolina, Great Triangle region. For the last 12 years, we have been taking care of thousands and thousands of patients with various problems, particularly a lot of colorectal cancers, stomach cancers, liver cancers. I want to introduce you to the new way of doing things with the robotic surgery with the Vinci system. We have been doing these surgeries for the last 8 years from 2012. I have done so far several hundreds for patients with the complex diseases, particularly colorectal cancers. We're able to cure them. Almost 70% of patients were cured without any need for chemoradiation therapy. Of course, most of them were early cancers. So today I want to show you the robotic system, the latest version of Xi. So this is the latest version of the Vinci system, Xi, and you can see very thin arms of the robot, four of them around the patient. So those arms are attached to the ports, working ports like these here. Those 4 arms are actually extension of my 2 arms working around inside the abdominal cavity or thoracic cavity based on where you are operating. My assistant will be with the patient, with the robot, handling instruments, changing instruments, also monitoring some of the metrics here, and then I will be the surgeon here in the console. This is the console. These are the working 2 areas where I work with only manipulating with the fingers, making fine movements. These fine movements are transferred to the robot, and the robot will pick up and execute all my very precisely directed energy dissection, taking out the tumor, lymph nodes, putting the sutures, putting the bowel back together, intestine back together, repairing large abdominal wall hernias, removing the tumors from the liver, gallbladder removal. Urologist will do prostate cancer. So I do most of the intestinal surgeries, cancers, diverticular disease, inflammatory bowel disease, of course hernia operations. So you would be wondering, why do we use the robot? What is the need for that? Let's go from open surgeries to robotic surgery where we are today. Several decades ago, we used to do all the operations by open operations. That means opening the abdominal cavity, put 2 hands, take out whatever we need to take out, put it back together. And the incisions were very large. Used to take several days to heal and patient to be able to go home. They used to take minimum 1 week, and to recover from surgery, able to get back to work, more than a few months. After that, we got into laparoscopic surgery, which is similar concept, but laparoscopic surgery, you will be at the bedside of the patient, instruments are inside, and then operating with the hands and camera. So then we got robot, the Vinci system, which is a great armamentarium for any surgeon, where the robotic movements are very precise, very fine. My hand can pronate and supinate 180 degrees at the most. But if I need to get my hand to go around 360 degrees in a very tight area, where, for example, in a rectal cancer is located in the deep pelvis. Around that area, we have so many important structures. There are a lot of nerves which are very important for reproductive system. There are blood vessels which are necessary for the circulation of the lower extremities, and there are kidneys connecting to the bladder with the ureters. Those are important things, need to be preserved. At the same time, every bit of cancer need to be taken out, particularly the lymph nodes. The lymph node removal is an essential part of cancer cure. To be able to remove all the lymph nodes, we need a good visibility, and also we need to get into every nook and corner of this deep pelvis, so that the Vinci system can get us deeper area where you cannot put any instrument directly, or you cannot put a hand inside. Because of that, we're able to cure a lot of cancers with a good tumor margins, removing the highest possible lymph nodes. Actually, in my practice, we have taken out almost 70-80 lymph nodes for rectal cancers. and those patients have been cancer-free for several years, almost more than a decade. I have a lot of patients completely cured from the cancer with the great results, completely preserved nerve function, and they're functional, gone back to life, gone back to work. So I see all the benefits coming from the age of open operation from 3-4 decades ago, and then laparoscopy and the robot. I have seen all three areas. I have done all these areas of operations. So I learned from open operations to laparoscopy, laparoscopy to robotic surgery. Coming from open surgeries to robotic, we have learned a lot. We were able to cure a lot of cancers, get my patients back to the life, back to the work with a complete physical functionality, and cure from the lot of colorectal cancers. So we are here to serve you. If any questions, please call us. We'll be happy to talk to you.